Carrie Kuyumjin. I'm one of the genetic counselors in the Fetal Diagnostic Center. There are many different types of prenatal tests that are available, and the lists of these tests can become overwhelming. None of these tests are required, and it's important to remember that as a patient. It's our job as genetic counselors to help patients decide if any of these tests are things that they would like to pursue. So the two categories of testing are screening tests and diagnostic tests. Screening tests are non-invasive and they pose no risk of pregnancy loss. And on the other hand, they don't provide diagnostic information. They give you an idea of a risk for certain conditions. Diagnostic tests do come with an associated risk of miscarriage. However, they also do provide diagnostic information. In terms of screening options, the first option available with respect to gestational age would be a first trimester screen. This is performed between 11 and 14 weeks gestation and involves an ultrasound and a blood test. It provides risk assessment information for Down syndrome, which is a chromosome problem, and two other chromosome problems which are less well known to most people, called trisomy 13 and trisomy 18. There are some tests that can be used to combine the first trimester assessment with a second trimester blood draw. Those are called integrated screens or sequential screens. And then there are other tests which can be done in the second trimester only. These days we're most often offering quad screening, which is just a second trimester blood test, and it provides risk information about Down syndrome, trisomy 18, and neural tube defects, the most well-known of which is spina bifida. The results of all of these different types of screening tests are reported out in the form of a ratio or a percentage. So they don't give a yes or a no answer, but they provide a patient with an idea of their baby's risk for certain conditions. Each test has its own associated detection rate and false positive rate, and patients can use the results of these screening tests to help them decide whether or not they'd like to go on with any further diagnostic testing. So diagnostic tests actually provide a diagnosis as opposed to a risk assessment. These tests can be used to identify chromosome abnormalities, genetic mutations, biochemical abnormalities, among other things. Diagnostic tests are considered invasive, so there is an associated risk of miscarriage. In terms of gestational age, the first diagnostic test we can offer is called CVS, or chorionic villus sampling. This is actually a placental biopsy, and we can do this as early as 10 weeks and into the 13th week of gestation. The physician can go in either cervically or abdominally to obtain some placental tissue, and this is what we use for testing. The associated risk of miscarriage is about 1%, which combines the actual risk of the procedure with the baseline risk of miscarriage at that time in pregnancy. The second diagnostic test that we can offer is something called an amniocentesis, and this is probably a little bit better known to most people. It can be done starting at 15 weeks gestation and any time beyond. It involves a sampling of amniotic fluid to do testing. Within the fluid are fetal cells, and that's actually what material is used to perform the genetic tests. Amniocentesis is always done abdominally with a needle, and it's associated with about a 1 in 400 risk of miscarriage. Both CVS and amniocentesis are done under ultrasound guidance, so the physician has a window into the procedure. Results of either test are available typically between about 10 and 14 days after the test is done. Some testing can take longer if it's not routine or typical. And we usually report those results out directly to our patients. Another type of diagnostic testing is called PUBS, or Percutaneous Umbilical Blood Sampling. It's done a little bit less commonly because it does have a higher miscarriage rate, and it's really not a test that's necessary to get chromosome information. It's more often used for other more rare indications. We as genetic counselors work with you and your physicians to help you make decisions about whether these tests are things that you might want to consider.